It might be helpful for me to understand what you've been told so far about Rob's situation.
Well, I know it's pretty bad. It's got some brain injuries, pretty serious.
Okay. What I might do then is recap the circumstances that have led us to this meeting so that we've got all the background and I can know that you've understood all the factors. Is that okay? All right. But just to recap, as you're aware, Rob was engaged in a very severe motor car accident yesterday. During the course of that accident, he suffered quite a serious blow to the head, a very severe injury to the brain. And one of the things we've been trying very hard to do for him whilst he's been in the ICU with us is to try and limit any further damage to the brain that can occur after such a serious incident. We know that when the brain's been taken such a blow as Rob's has, that there's often secondary injuries that occur. The brain frequently swells. We've tried a lot of different treatments to try and limit that as much as we possibly can, but over the course of the last 24 hours it's become apparent that those treatments haven't been effective, and despite our best efforts in the ICU, we've seen quite a serious deterioration in Rob's progress. We've done a sequence of important tests on Rob's brain to try and ascertain with absolute confidence exactly how serious this is. We're really looking for very basic things. For example, can Rob take even a single breath for himself? Can he cough? Does he have some basic eye movements or eye function? And these tests have been performed by some of our most experienced specialists, and they've shown that Rob has no brain function when we test him. What this tells us quite convincingly is that there's no blood flow at all now to Rob's brain. And the implication of that is that Rob's brain has died.
It looked fine out there. It looked like it was just sleeping.
His body was warm. Touching him.
Sometimes this happens with patients in intensive care who've had a very serious brain injury that's caused extreme brain damage. It can look like they're in a coma, or families often tell us that they look like they're asleep. But in Rob's special situation, the testing is very clear that he's lost all brain function and that he's, a term we use is brain dead. You may have heard that term used before.
He's saying, so there's no hope that you haven't known of any cases where they've recovered?
Unfortunately not. We can be quite certain in these situations that recovery never happens. One important point that you brought up before, Fabian, is that you mentioned that your dad looked like he was breathing and was warm and pink. And under this situation, that's what we would expect to see, that the brain has died completely. Because your dad's died on a ventilator, the brain has completely stopped working. The ventilator just pushes the air in and out of the lungs still, so it will look like he's breathing because his chest is still moving. And similarly, the heart is still beating so that it's pumping blood through the rest of the circulation, and all of the organs are still supplied with blood, and his hands and feet are warm and pink, and he looks asleep, but we can be very certain that the brain has died completely. In a situation where we have a person whose brain has died completely, so that they are brain dead, what that also means is that we can say that the person themselves has died. I know that might seem like an odd thing to say about someone who's still got a heartbeat, but we can be very certain that in this situation where the brain is entirely dead, we can say the same for the person, that the person has died, and I'm sorry to be the one to tell you that Rob's died.